Good morning and welcome to your Robert J. Dole VA Veterans Town Hall meeting this morning. My name is Gene Kimball. I'm the Deputy Public Affairs Officer here at the Dole VA, and I'm going to be your moderator for today's Town Hall. Before we go any further, please join me in reciting the Pledge of Allegiance to the United States of America, and please keep your mics muted if you would. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you very much. Today, we're going to provide some updates on VA programs and services, followed by fielding your questions. But let's review some housekeeping notes first. Please be aware that today's session is being recorded so others may view it at their convenience. If you have questions at any point during the briefing, we encourage you to submit it via the chat at your earliest opportunity. Also, at the end of our presentation, we'll allow guests to unmute their mics and ask questions. When asking questions or making comments, please refrain from sharing personal information during this session, whether it be your personal information or that of a comrade or a friend. We do want you to be aware the link to this town hall has been shared publicly, meaning anyone could be logged in and watching us. So to get with it, Mr. Michael Payne, Medical Center Director, joined the Dole VA last July. Since then, he has devoted himself to furthering the mission of providing world-class care to the veterans we serve. He is here this morning to address a few hot topics with us. Sir?
Hey, good morning, and thank you, Mr. Kimball, and welcome to all of our veterans. We're honored and privileged to have you on the line today. So, a few updates from me. During the October 2023 session, which was our Veterans Town Hall, I discussed with you all the priorities that were laid out by the VHA Undersecretary, Dr. Sharif Eldenhall. And those three priorities were connecting veterans to the soonest and best care, serving veterans with military environmental exposures, supporting veterans' whole health, their caregivers, and survivors. And today, I'd like to share with you some of the plans that our team has put together to meet or exceed these goals. Okay, next slide, please. So with regard to connecting veterans to the soonest and best care, community care, more specifically, we are partnering with our local and our regional entities to improve access to our services. Partnerships include discussion with rural facilities such as El Dorado and several others that are here within our Wichita and Sedgwick County catchment area and beyond, and to potentially increase access for inpatient, primary care, and outpatient services. We've also saw a 35% increase in the number of veterans who were eligible to go into the community for care, but chose instead to stay within our VA system. That speaks not only to the increased access, but also to the quality of care that we provide to our veterans. This is also one of the rationales that we were able to achieve a 0 findings on our OIG CHIPS report, as well as our CMS 5-star rating when compared to our counterparts within the community. With regard to technology, we've also hit the ground running in that area with regard to access. During our last Veteran Town Hall, we discussed our new patient check-in tool, also referred to as PCI, and this allows veterans to check in for appointments with their cell phones. This improves not only the efficiency and access, but also veteran satisfaction. We've also seen a modest increase in the number of veterans seen within the established wait time goals, and that's for nearly every area of care, primary care, mental health, and specialty care. We've implemented tactics to focus on primary care, specialty care, and mental health care. We've also, quite frankly, we've done a lot better than we even set our goal out towards a few months ago. And we're now meeting our wait times with mental health, primary care, and specialty care in our North Star metrics and in our internal tracking tools. Okay. Let's go to enrollment opportunities. With regard to enrollment opportunities, the Department of Veteran Affairs recently announced enrolling 401,000 veterans in the VA healthcare over the past 365 days. That represents a 30% increase over the previous year's 307,831 veterans. During FY 2020 and 2021, the Dole VA enrolled an average of 765 veterans into healthcare. Midway through 2022, we added an outreach coordinator, and in 2023, we enrolled 1,289 veterans here at the Dole VA. We have outstanding relationships and coordination with our VSOs and our Kansas Commission on Veteran Affairs. We focused our activities on eligible veterans, and we meet them and their needs where they are, and that includes their families and caregivers as well. We have a great relationship with the McConnell Air Force Base, and we meet service members' needs there. But we also bring them over to our system for training, and we partner with them on care opportunities as well. Some eligibility and enrollment outreach events that are upcoming, and those are listed on the slide. So Lowe's would be East Wichita, Saturday, April 27th. So that's next Saturday from 9 o'clock to 1 p.m. We have a Vet Fest at the Dole VA front lawn on Friday, May 17th from 10 a.m. to 2 p.m. That's going to be a lot of entertainment, and that should be a really great event for each of you. And we are also going to be at the Lowe's in Derby on Saturday, May 18th from 9 a.m. to 2 p.m. And this is not an all-inclusive list. We continue to look for opportunities to enroll our eligible veterans and veterans within the Wichita area, surrounding areas, Sedgwick County, and even other areas that move to the Wichita catchment area from another VA. So we're always looking forward to increase our enrollment so that we can serve our veterans and their families, caregivers, and survivors and meet their needs where they are. So next slide, please. Okay, we're on the right slide. So this slide is, I want to focus on serving veterans with military environmental exposures. So everyone is aware, or should be aware, of the PACT Act now. And the PACT Act was established in 2022 to provide health care to all veterans exposed to toxins and other hazards during their military service, whether that was CONUS here at home or OCONUS overseas. More than 3,800 Kansas veterans have enrolled since the PACT Act was established. On March 5th, a significant expansion to eligibility under the PACT Act was announced. And I think Mr. Herndon is going to speak a little bit about that, or Mr. Kimball, later in our meeting. Next slide, please. Supporting veterans' whole health. Whole health has been VA's approach to care that supports your whole health and well-being. Whole health centers around what matters to you, the veteran, not what is the matter with you. This means that your healthcare team will get with you and they will get to know you as a person before working with you to develop a personalized health plan based on your values, needs, and goals. PAC teams have been utilized here at the Dole VA for several years. We believe this model provides for more personal, more efficient, and better care for our veteran population. Providers work together on each individual veteran's care plans. They get to know the veteran and understand understanding each provider's strengths to address specific issues with each veteran. Dole VA's whole health program is robust and it offers multiple courses for veterans to use. The spring and summer whole health catalog of courses was just recently released, and a link to that document is going to be in the presentation, or we can drop that in the chat. Whole health programming ranges from yoga, Tai Chi, Qigong, walking, movement groups, to self-care, creative art therapy, and gardening groups, to tobacco cessation, diabetes education, and battlefield acupuncture. And that list is not all inclusive. So we encourage veterans to speak with their primary care providers to discuss options that may be suitable for them. Next slide, please. Okay, so combating veteran homelessness is a topic that's near and dear to my heart. It's near and dear to the Secretary's heart. It's near and dear to every senior VA leader's heart. So the Dole VA joined the City of Wichita, and we continue to partner with the City of Wichita and United Way in a program to achieve functional zero homelessness in Wichita and the surrounding area. Functional zero for homelessness is achieved when we have fewer veterans entering homeless than the number leaving homelessness. Our coalition is dedicated to meeting this benchmark by the end of 2024. A number of Dole VA staff participated in the 2024 point-in-time count for homeless veterans in January of this year, and just homelessness in general, so it wasn't just for veterans. And also in the 2023 point-in-time count, there were 49 homeless veterans identified. According to our homeless program team, that number has dropped to 26 prior to this year's count. So some of the programs that we offer here at the Dole VA include immediate food and shelter, and that includes both transitional and permanent housing, job training, life skills development, and education. We also offer support with justice system issues, navigating the justice system for criminal offenses, and community reentry from jail. We offer financial support to prevent homelessness, treatment for addiction and depression, and health and dental care. We as a team here at the Dole will continue to work towards attaining each of these program offers and goals, and many other goals that I did not speak about, which lead to providing world-class care to our veterans who entrust us with their care. Thank you for your service. Thank you for attending today's session, and we look forward to serving you in the future. Back to you, Mr. Kimball. Thank you.
Thank you, Mr. Payne. Certainly appreciate your time, and we're glad that you're here with us at the Dole VA. Many of you have heard of the PACT Act, although many don't know some of the more minute details. Today, Jeff Herndon, Dole VA's Public Affairs Officer, is here to share those details with you, as well as information about some of the recent changes. Jeff?
Thank you, Gene, and thank you to all of you for joining us today. This section of today's town hall, as Gene mentioned, is going to inform you about recent changes to Section 103 of the PACT Act. I've got a lot of important information to share here, so I'm going to keep my camera off so that you stay focused on the information that we're sharing. Next slide, please. So the PACT Act is very comprehensive and addresses a full range of issues impacting toxic exposed veterans and their survivors, and will help VA meet the growing needs of veterans today and in the future. The PACT Act expanded VA healthcare eligibility to thousands of veterans, improved VA's presumption decision-making process. It bolsters VA's toxic exposure resources for veterans and their families, strengthens our toxic exposure research, increased benefits claims processing capacity. It strengthens our workforce, which leads to improved and faster care for our veterans, and it authorized funding for VA facility leases. Next slide, please. Under the PACT Act, all toxic exposed veterans were supposed to become eligible for VA care in increments between now and 2032. VA eliminated the phased-in approach, meaning that 3 new cohorts of veterans are now eligible to enroll in VA healthcare as of March 5th of this year. It is important to note, veterans must still meet the minimum active duty service and discharge requirements to qualify for VA healthcare under PACT Act authorities. Next slide, please, Gene. So the 3 new cohorts are: number 1, veterans who participated in a toxic exposure risk activity, commonly known as a TERA, as defined by law while serving on active duty for training, or inactive duty training. Some of those terms are critical to our National Guard's veterans because they apply. For example, inactive duty training applies primarily to the National Guard and the reserves. Veterans who were assigned to a duty station in, including airspace above, certain locations during specific periods of time. That is on or after August 2, 1990 in a number of countries. You can see them there. On or after September 11, 2001. Again, a fairly comprehensive list of countries listed there. And veterans who were deployed in support of operations Enduring Freedom, Freedom Sentinel, Iraqi Freedom, New Dawn, Inherent Resolve, and Resolute Support Mission. Next slide, please, Gene. VA has determined that veterans who were exposed to one or more of the following hazards or conditions during active duty for training, or inactive duty training participated in a TERA. Examples of activities include being exposed to air pollutants, chemicals, occupational hazards, radiation, and warfare agents. Again, information that is important to note. This is not a comprehensive list, and there's no timeline associated with risk activities. Veterans can view additional military exposure categories on VA's public health website. I just want to point out real quickly, you can go ahead and move to the next slide. There's a lot of links in this presentation. We are converting it to a PDF, and it will be shared in the chat. It will also be shared on our VA Wichita Healthcare website, so you can access it there as well. So veterans who served in the following locations and time periods are also eligible to enroll in VA healthcare effective on enactment. Those who served in the Republic of Vietnam between those dates, Thailand at any U.S. or Royal Thai base between those dates, or Laos between those dates, certain provinces in Cambodia, Guam or American Samoa or their territorial waters between those designated dates, or the Johnston Atoll or a ship that called there in the early to mid 1970s. Next slide, please. What are the minimum active duty service requirements for VA healthcare? In general, veterans must have served 24 months of continuous active duty, or the full period for which they were called or ordered to active duty. Former members of the Reserves or National Guard are eligible for VA healthcare if they have qualifying service, as I just described above, being called up to active duty and fulfilling the entire period, and meet one of the healthcare eligibility requirements in the PACT Act. Former members of the Reserves or National Guard who only served for training purposes may not be able to establish veteran status if they did not incur a qualifying disability during such training. Some exceptions do apply. You can visit that website for more information. There are exceptions to the minimum active duty service requirements, and those minimum active duty service requirement for VA healthcare may not apply if any of these are true. The veteran was discharged or released for a qualifying reason. The veteran was discharged for a disability that was caused or made worse by active duty service, or the veteran served prior to the early 1980s. We encourage all veterans to apply to determine their enrollment eligibility. You can visit that website, healthcare/eligibility, for more information. Next slide, please. There are 4 methods veterans can utilize to apply for VA healthcare. They can apply online on VA's website. Please note, a link to apply for VA healthcare is available on the homepage of every VA Medical Center website, as well as many of the subpages associated with those sites. Veterans can call the toll-free hotline, mail a 1010-EZ to our health eligibility center in Atlanta, or visit any of our facilities in person. Yes, veterans can even visit our C-Box, where one of our MSAs at the front desk will provide them with a copy of the 1010-EZ. The veteran can fill it out on the spot, and C-Box staff will send it to our eligibility and enrollment department via courier, or the veteran can take it home, fill it out, and mail it to the HEC. Next slide, please. So why should veterans choose VA for their health care? There are many reasons. VA provides the best and most affordable health care for veterans in America, and this is your chance to apply. Veterans who are enrolled in VA healthcare are proven to have better health outcomes than those who get their care elsewhere. And this year alone, VA has beaten non-VA hospitals in quality ratings and patient satisfaction ratings. That's because our clinicians know veterans. They often are veterans, and they know exactly how to help. And VA healthcare isn't only the best option for veterans, it's often the most affordable, with copays as low as $0 for prescriptions, urgent care, outpatient care, and more for some veterans at VA. Locally, we have a few facts we can share with veterans about the quality of care we provide at Dole VA. We received a 5 out of 5 star rating from the Center for Medicare and Medicaid Services in their first rating of VA facilities. We are one of only 2 facilities in VISN 15 to receive 5 stars. Dole VA's trust score stands at 92.6, meaning nearly 93% of veterans who have used Dole VA services in the last 90 days trust us to provide them with the care they need and will return for other services as needed. Also, in 2022, we were designated a Pathway to Excellence healthcare organization by the American Nurses Credentialing Center, placing us in an elite class of healthcare organizations where there are just 3 in the state of Kansas and 204 in the world with that designation. We're quite proud of all of that, and we have a lot of other indications that our quality is very high at Dole VA and our customer satisfaction is as well. Next slide, please. A toxic exposure screening will be provided to all veterans enrolled in VA healthcare at least once every 5 years. A screening is a brief conversation averaging 5 to 10 minutes to identify and document any potential exposures to toxins during military service. Toxic exposure screenings support the long-term health plan of the veteran, ensuring they receive informed whole health care and connect them with follow-up resources as requested. Next slide, please. The PACT Act establishes presumptions of service connection for more than 20 presumptive disease categories related to toxic exposure. Within those categories, there are more than 300 conditions possible. For Vietnam veterans and other veterans exposed to tactical herbicides, monoclonal gammopathy of undetermined significance, or MGUS, and high blood pressure, commonly referred to as hypertension, are both presumptive conditions. Next slide, please. VA will contact veterans when a presumption of service connection is established or changed. You can learn more at our va.gov/PACT website. Veterans who were previously denied a toxic exposure-related claim are encouraged to file a supplemental claim using VA Form 20-0995, Decision Review Request Supplemental Claim. Most claims that were previously denied will not be automatically reviewed under the PACT Act. Survivors who were previously denied dependency and indemnity compensation, or DIC, related to any of the new presumptive conditions are likewise encouraged to refile a claim. Veterans who have not previously filed a claim and are diagnosed with one of the new presumptive conditions and meet eligibility requirements should submit a new claim on VA Form 21-526EZ, Application for Disability Compensation and Related Compensation Benefits. Survivors who have not previously filed a claim and meet eligibility requirements should submit a new claim on VA Form 21P-534EZ, or Application for DIC, Survivor's Pension, and/or Accrued Benefits. Veterans will need to be prepared to submit any supportive medical evidence, and claims processors can help with this process. Anticipating a rise in claims backlogs due to the scope of the new law, VBA is aggressively working to hire more processors and enhance claim decision support technologies to increase efficiency. Next slide, please. There are additional resources of information for veterans and stakeholders. In addition to these websites, next slide, please. We know life is busy, so Dole VA and VBA's Wichita Regional Office are hosting events to bring the opportunity to you to enroll for health care, start a disability claim, or simply get answers to your questions. Our outreach team will be at the East Wichita Lowe's on April 27 and at the Derby Lowe's on May 18. Next slide, please. We're also hosting our PACT Act Spring Fling on Friday, May 17th, here at the Dole VA campus. We're holding this on our south lawn, right by the big flagpole. Join us between 10 a.m. and 2 p.m. for a town hall, sessions of yoga and Tai Chi, healthy cooking demonstrations, and the usual opportunities to enroll for healthcare, process disability claims, and get answers to your questions. We'll be serving a free lunch with cooking provided by Wichita Wagon Masters, and the Sedgwick County Register of Deeds will be on site to record your DD 214 for you, absolutely free. Stick around after 2 for some great entertainment from local musician Jalen Johnston and country music artists Jared Blake, Big Vinny, Jason Michael Carroll, and Craig Campbell. You can watch our website and social media pages. We're on Facebook and X, which is formerly known as Twitter, to be informed about other events we will schedule. We'll be holding events not just in Sedgwick County, but throughout the 59 counties we are responsible for. That concludes today's presentation on the PACT Act, but since I have the microphone right now, I'll let you know about one other event we have coming up. Next slide. Thank you. On Tuesday, April 30, we will be hosting our annual Vietnam Veteran Commemoration Ceremony. This will take place at Wichita State's Hughes Metroplex. We have enough space to honor 150 Vietnam veterans this time. We sent letters out to thousands of veterans who are enrolled with us and indicated that they are from the Vietnam era. The response was very swift, and all of the slots for this ceremony are already filled. These events are the main focus of the United States of America Vietnam War Commemoration, a national 50th anniversary commemoration authorized by Congress, established under the Secretary of Defense, and launched by President Obama in 2012. Congress penned a total of 5 objectives, with the primary being to thank and honor our Vietnam veterans and their families for their service and sacrifice on behalf of our nation. Next slide, please. Thousands upon thousands of organizations known as commemorative partners have joined in the noble mission of honoring our 7 million Vietnam veterans living at home and abroad, and the 10 million families of all who served. Publicly and individually, Vietnam veterans are being presented with a Vietnam Veteran lapel pin, a lasting memento of the nation's thanks. So, who is eligible for recognition through these ceremonies? Living U.S. veterans who served on active duty in the U.S. Armed Forces at any time during the period November 1, 1955 to May 15, 1975, regardless of location. We make no distinction between veterans who served in country, in theater, or who were stationed elsewhere during the Vietnam War period. All were called to serve, and none could self-determine where they were stationed. You can visit the 50th Anniversary Committee's website to find other events. If you are not able to attend an event, you can request a lapel pin be delivered to you by mail at that website. We have received requests to mail pins to veterans here in Kansas. I regret to tell you that we are not able to do that locally. However, we have found the committee's team to be very responsive when a lapel pin is requested from them by mail. That concludes my presentation. We'll answer any PACT Act related questions or other questions at the end of today's town hall. I'll toss it back over to you, Gene. Thank you, everybody, for your attention.
Thanks, Jeff. What a great amount of information that's perfect for today's presentation. So As most of you know, we are pretty much always under construction here at Dole VA. Nick Howard of our facilities management team is going to give us an overview of some of the ongoing projects. Nick?
Thank you, Gene. I appreciate everybody joining us today, and I'd like to say thank you for your patience as we do work through all these construction projects around station. We recognize that they're not always convenient, but we do what we can, and our goal is to reduce the impact of the veterans' care as much as possible. So our first slide we're going to talk about today is our 3 East, 3rd floor of Building 1, our patient privacy space. The renovation provides 10 private rooms with restrooms. It's currently under a design and construction modification to make some corrections to our room conditioning systems. So we hope to have that taken care of soon and back into service. Next slide, please. Our next project we'll discuss is our Building 13, our boiler house. Steam is very important to us here at the medical center, and this boiler plant is what provides our steam. We use steam to not only heat our facilities, but also clean surgical equipment and many other things. So it's a very important part of what we are and what we do. This particular project upgrades the facilities and modernizes the capabilities of the facility. It'll be done. Our current completion date is December 2024. Next slide, please. Our Building 4 renovation. This project renovates the entire interior of the building, as well as makes some repairs to the roof and some damages caused by a water intrusion and water damage. We are about 90% complete on the first phase, which is the ground floor east side. When we finish that up here shortly, we'll be moving the prosthetics team, which is currently across the hall on the west side of the ground floor, into that space in May. The first floor auditorium space has been delayed because of extensive abatement and other construction things that have come up during the process of construction, which is not unremarkable for a building of this age and size. So we hope to have that completed by late summer, early fall this year. Next slide, please. And finally, the last couple projects I'd like to speak to is related to our electronic health records medical records system. There are a couple projects going around station. First is the infrastructure project. This upgrades all of our infrastructure related to our network. So data cables, data closets, things of that nature. The second project is our electronic health records training space. It's about 90% complete. This will provide space for us to train staff on the new medical record system that is being implemented throughout the VA. And that is all I have. Thank you, Gene.
Thanks, Nick. Appreciate you stepping in today and giving the presentation. One thing that I'd like everyone to know is that what we've done is we've chosen to talk about the projects that are ongoing. There are a number of projects that are in process being discussed for the future. Our facilities management team and our executive leadership team have those discussions at all time and continue to move this medical facility forward. So we don't report on those because those haven't been finalized yet, but I can just tell you that there are a number of those projects coming up in the future. So thanks again, Nick. So Dole VA supports minority veterans, and Greg Harden, our Minority Veteran Program Coordinator, is here this morning to share more. Greg? Greg, you're muted.
Greg.
Okay, here we go. Good morning. My name is Greg Harden. I currently serve as the EEO Program Manager for the facility, but I'm also the Minority Veterans Program Coordinator. And I wanted to get my face out there so you all know who I am. I am also a 23-year veteran of the Air Force, so a fellow veteran. My job as the Minority Veterans Coordinator, we represent the Center for Minority Veterans. And the Center for Minority Veterans is a organization that's mission is to give voice to the underrepresented communities that our veterans come from, with a focus on African American, Hispanic, Native American, Alaska Natives, Asian American, Pacific Islanders, and the LGBTQ community. And that is a mandate by law that we focus on those areas. My job as the coordinator locally, next slide, Gene, is to promote the use of VA benefit programs and services by minority veterans, supporting and initiating activities that educate and sensitize internal staff of the unique needs of minority veterans. So we work with the staff to make sure that we are being culturally sensitive to our minority veterans when they come into the hospital for services. And we target outreach efforts to the minority veterans through the community networks. You see that we're, as a center, are doing a lot of outreach in the community, where we also try to target specific communities for that outreach. They may not otherwise get out into the general community. So we want to make sure we're hitting all of those different communities as well. And then working with the Center for Minority Veterans, we identify gaps in services and making recommendations to make sure that we're improving our service delivery within our facility. One example is the STRONG Act that recently was approved by Congress, works to make sure that the VA is working with the Indian Health Service for veterans in that community to make sure they're getting the health care that they need. We try to make sure that we're getting out into those communities and letting them know what's available and how to navigate getting that health care when needed. So you all will start seeing me a little bit more in the community, and moving forward, I will bring information to these town halls when we have things to report out. Otherwise, here's my information. If you have any questions or need to contact me, that's my contact information. And I look forward to serving you and meeting you. Thank you.
Thanks, Greg. Appreciate that information. So I received a call last week from Aaron Vilsinger, Acting Director of the VBA Regional Office, and he's joined us this morning to give us an update on some of the happenings in their programming. Aaron.
Good morning. Thank you, Mr. Kimball, for including VBA in this town hall. So first, I just wanted to foot stomp some of the things that Mr. Herndon mentioned earlier in the presentation, and that is that the PACT Act is here to stay. And veterans and survivors can file for benefits at any time. The sooner you file, the sooner you can start getting your earned benefits. So please don't wait, file your claim, or quickly submit your intent to file today. There are a number of ways in which you can file a claim. If you already are working with a veteran service organization, claims representative, or private attorney, they can work with you on how to file a PACT Act claim. You can also file a claim or get additional information about applying for benefits by visiting our website. That's www.va.gov/PACT, or by calling 1-800-MY-VA-411. We also have public contact specialists that work directly with veterans in answering claims-related questions and taking benefits claims. We have one individual located at Building 61 on the Dole VA Medical Center campus. We also have a team of public contact personnel located at the regional office space, which is located at 9111 East Douglas Avenue, Suite 200. I'm happy to announce that at our new location, we have multiple interview rooms so we can assist multiple veterans at a time, as well as ample parking for veterans seeking assistance in filing claims or getting claims-related questions answered. Additionally, I want to talk about a couple other initiatives that are going on at the VBA regional office here in Wichita. The first is we, much like our VHA partners, are trying to conduct as many outreach activities across the state of Kansas, taking VA information, benefits related information, and the ability to answer questions, take claims to various communities across the state. And so one of the two initiatives I want to talk about a little bit this morning is our outreach mailer campaign. So we have designed and sent out an informational packet regarding PACT Act benefits to various communities across the state of Kansas. This packet also contains information regarding our veteran readiness and employment program. So for those veterans looking for assistance with vocational training or employment assistance, that information may be of a special interest to you. And so if they aren't in the communities that you are living in, please let us know so that we can get that information into a location accessible by veterans in any communities that we may have missed across the state of Kansas. Additionally, we are working with our VSO partners to provide survivor benefits training to the VSOs, and this will be open to VSOs co-located at our VBA facility, as well as veteran service representatives and VSOs throughout the state of Kansas. And so we're looking to host that event on May the 9th, 2024. So if you're interested in attending and you are a VSO or a VSR, please reach out to our office at 316-651-3602, and we can get you added to the training invite. Next, I want to talk about ongoing hiring at the VBA regional office there in Wichita. The PACT Act and the number of applications and enrollments, both in the VBA space and the VHA space, have increased quite a bit. And that's not specific to the state of Kansas, but that is common across the entire VA organization. And so as a result, several regional offices and healthcare facilities across VA are hiring to meet those needs of the additional veterans being enrolled or seeking benefits through VBA. And Wichita is no different. From 2021 through April of this year, we have added 25 new staff members to the Wichita VBA regional office. Please note that that only accounts for the addition of new staff and does not account for any internal promotions within the regional office space. And then finally, I wanted to conclude with an announcement that's open to veterans and the community at large. We are in the process of planning a grand opening or ribbon cutting ceremony at our new VA regional office location. Now, before I get into that, I did want to point out that the regional office is already open. We are already accepting walk-in traffic from the veteran and general public. So from the veteran community and the general public, rather. So that has been ongoing since October of 2023. But we wanted to do a grand opening, invite the community, our key stakeholders to view our new space and all the efforts that have gone in to design a space that is intended to be welcoming and inviting to veterans and the general public, all with the goal of providing world-class service and access to benefits and care administered by VA. And so tentatively, we've planned this event for Thursday, June the 6th. As more information becomes available and that date becomes finalized, we will be sharing that with our community stakeholders, as well as putting out a media release to the general public at large. And so I hope that if you have some time on that day, that you are able to join us and help us open our new regional office space located in the Ruffin Building here in Wichita, Kansas. So thank you very much, Mr. Kimball, for the opportunity to present on those topics. I'll now pass the mic back to you and await any questions at the conclusion of the presentation.
Thanks, Aaron. I appreciate you joining us today. Great information, beautiful new offices out there. So happy to have you present your information. So that brings us to the conclusion of our presentation today. It brings us to a question and answer portion of the program. So I've kind of been checking the chat as we've gone along, and I haven't seen any questions being posted in the chat. But as always, we would open the mic. We would open this time up if you'd like to open a mic and have any questions to ask any of those who presented. Questions about today's presentation, feel free to do so at this time.
Hey, Gene, it's Jeff. I have uploaded a PDF copy of today's presentation in the chat. I know that sometimes people who are external to the organization can't access the chat. So if you go to our va.gov/Wichita Healthcare website, it will be posted there under the About Us section here before the end of the day. Also wanted to say that similar to a comment that Mr. Payne made, and Mr. Filsinger may have mentioned also, in our outreach events, we enjoy a great relationship and support from the Kansas Commission on Veterans Affairs. They have a lot of service officers who have the capability to assist veterans with processing disability claims, and they're always more than willing to send staff to support those outreach events. So thank you to the Kansas Commission on Veterans Affairs for everything you do to help us out.
Thanks, Jeff. Great comment. Anyone else with questions or comments? If not, I think we're going to call it a day. I appreciate everyone joining us today. We look forward to seeing you again soon. Our next Veterans Town Hall will take place in about the next quarter, so about 3 months, and we will provide information as to how to join. So again, thanks. Hope everyone has a great day.
Gene, there's one question in the chat box and a hand up.
Any word about other locations for potential CBOCs in the near future? Mr. Payne, I see that you're still on. Do you have any comments on that?
Yes, hello. So thank you for the question. We do not have any plans for any additional CBOCs at this time. However, we are always surveying our veteran demand within our catchment area and our surrounding communities. And if we determine that that need is there within that particular area, there's a process that we'll go through, and we'll be sure to inform everyone of what the outcomes and recommendations are. Thank you.
Thank you, Mr. Payne. Allison Vesper has your hand up. Question?
Yes, sir. My question was in regards to that same question that was in the chat. I had read about a year ago that that was already approved on the federal level to put 2 new CBOCs in it on the west side of Wichita and then one in Derby. Have they reversed that?
In addition to whatever Mr.
I couldn't get off mute. Go ahead, Mr. Herndon, and I can chime in.
I was just going to say, while a study was done that we call a market assessment, and it was recommended that we look at doing that, I don't think that it was ever actually published as being approved. It was something that we were looking at, but then I'll let Mr. Payne talk about where we're at on that currently.
Sure. So thank you for the question. That study that Mr. Herndon is referring to was a study that all VAs went through called the Air Commission. And the Air Commission report was released a year and a half ago, maybe even 2 years back. And those studies were consistent with recommendations from various committees at that time. The VA hired private contractors to come in and assess every single catchment area that we had within our footprint to assess the feasibility and the demand for varying care options. So that study at that time did recommend that. That was unfortunately recommendations only. There were no resources, there were no firm decisions that were being made out of that. And ultimately, that commission was actually disbanded and disfunded as well as of about a year and a half ago. So unfortunately, those recommendations were just that, recommendations at that time, but the VA has opted to not pursue that due to budget requirements and other various reasons. But that doesn't mean we won't continue to assess our areas locally, and if there's a need, we will continue to address the need, or we'll continue to put assets where those needs are within our veterans communities. So thank you for the questions.
All right, thank you so much. I appreciate it.
Sure, you're very welcome.
Any other questions this morning? If not, I think we're going to call it a day. Again, thanks so much for joining us, and we'll see you next time. Thank you.
Okay, thank you all.